The number of confirmed cases of coronavirus in South Korea has doubled in just a day to 204. This coming as China's National Health Commission says another 118 people have died, bringing the total number of deaths in mainland to 2,236 people. Joining us now is Dr. Margaret Harris, spokesperson for the World Health Organization. We're also joined by Yahoo Finance's Anjalee Khemlani. Good morning to you both. Dr. Harris, I'd like to start with you. I'm sure you are aware that Chinese officials in the province hardest hit by the coronavirus are admitting for the first time this morning that their methods of confirming and reporting infection numbers have actually sown confusion and mistrust. What is your response to that?
So it's always quite difficult when an epidemic is evolving. What they were trying to do was widen their definition. They did this a couple of weeks ago when the laboratories were overwhelmed and they simply couldn't get the testing done quickly enough. So they widened the definition in Wuhan so that they could capture anybody who needed help. By capturing, I mean it's somebody who looked like they had coronavirus would get help and would be counted as having coronavirus. Now that things are settling a little, they're able to go back to simply waiting for the laboratory test to say, yes, this is definitely coronavirus. But this is always a problem when people are very, very anxious and they look at numbers and data as kind of the gold standard. So people get concerned when things seem to be changing like that.
Dr. Harris, this is Anjalee. I know that the number that was counted as part of those clinical diagnosis tests, that is now part of that more than 75,000. I think we're above 76,000 now cases reported around the world. So with those cases now not being counted, does that fall off? Like, how are we officially counting these numbers now?
Well, so really what you need to do when you're looking at case numbers, especially when you're looking at epidemiology, you're not actually looking at whether it's really one or two. What you want to know is it in the order of a few cases, like 10, or is it in the order of 1,000, which is a bigger outbreak, or what we've got here, a very large outbreak in over 74,000. So what you need to look at is the trend. Is it going up? Is it going down? Is it leveling off? Is it doing things in relationship to other things? Are the interventions that have been applied changing anything? So this is why you actually count numbers. You don't count numbers to say exactly, I'm absolutely certain it's 3, but you want to know whether it's in the order of 3 or is it in the order of 3,000.
Dr. Harris, how close are we to finding a vaccine?
That's work that's going to take some time. Now, we have 4 vaccine candidates, which is very good news. That means that testing is already starting. But a vaccine is something you give to healthy people. So you want to make absolutely certain that it's not going to have any untoward side effects. And that sort of testing takes time. I've been a healthy volunteer on testing for the Ebola vaccine. And, they had to test us for 6 months to make sure it wasn't causing any harm. So while the good news is we've got 4 candidate vaccines, you cannot expect to see anything for another year.
Dr. Harris, there was a cruise ship in Japan stricken with the coronavirus. In fact, 2 people who were on that ship died. Japan is coming under some real criticism right now for its handling to that response. Some are saying perhaps the quarantine was not sufficient. What are your thoughts? Is that criticism warranted?
It's a very difficult situation. You can see that the Japanese authorities were looking at at containment, at not having a potential outbreak spreading beyond the ship. But of course, there were difficulties because the outbreak did spread within the ship. So it's one of those situations where I think you're really going to be criticized no matter what happened. It was a very difficult situation.
I think Dr. Tedros has been really firm in saying that China's containment, speaking of containment, is one of the reasons why we haven't seen as many cases worldwide yet. But we are seeing that, as with the concerning news from Iran and South Korea. So is there any concern about how China has, in fact, handled this? We know that there's also been a prison that hasn't been infected because a guard came in. So there are a lot of these stories popping up, and we're still watching those numbers climb.
So the modelling study, so a number of different academic institutions around the world have crunched the numbers. And again, as we were talking before, they put a group of numbers. They don't say 1, 2, 3, but they look at what would happen if you had this bunch of numbers and these things were done and these things were done. And yes, they have come to the conclusion that China has bought the world quite some time, several weeks. And if you look at it, we're in that now, that several weeks period. And now we all have to start looking at really, we should have all prepared weeks ago because we knew this was coming. And I think some countries have prepared very well, not all. And this is very much what we as WHO have to do to really support all countries. And we as the world really need to stand together and support each other.
You know, Dr. Harris, I'm sure you're aware that the World Health Organization has also come under fire from some people saying that the agency may have been a little slow in declaring the virus a global health emergency, because that really allows a better coordination globally from different countries to work together to combat the epidemic. In hindsight, should the WHO have made that declaration sooner?
So as soon as it looked like this was a very, very serious outbreak that affected the entire world, we called together our emergency committee. And an emergency committee is different from each kind of outbreak. It's made up of experts in that field. It's not made up of WHO people. It's people that we call together from around the world. They're usually on a call, and the information that we have to date is presented to them, and then they debate it. And this happens over an afternoon. And they look at that information and they decide whether or not they think they should advise WHO, our Director General, to declare a public health emergency of international concern or not. Now, the first day they did that, they couldn't come to a conclusion. It was like the jury was out. They had different opinions. So the Director General said, "Okay, go back to work the next day and tell us, come to a conclusion." They still were divided. So he said, "Okay, come back next week." They went back next week. They had more information at that point, and that's when indeed the public health emergency of international concern, they recommended the public health emergency of international concern should be declared, and indeed the Director General declared it on that day.
All right, let's leave it there. Thank you, Dr. Margaret Harris and Anjalee Khemlani.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.